Welcome everyone to today's webinar, The Race to Virtual Patient Care, How Organizations Are Tackling the Shift. I am Molly Gamble with Becker's Hospital Review. We'll begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. At this time, it is now my pleasure to start today's webinar by introducing our two terrific presenters from Imprivata. We're thrilled today to be joined by Matt Eric, Vice President of Sales Engineering, and Joel Alcone, Product Marketing Manager. Joel, I'll turn the floor over to you now to begin today's presentation.
Thanks so much, Molly. And yes, today we are going to be talking about the race to virtual care. My name is Joel Alcone. I'm Product Marketing Manager here at Imprivata, and I focus on understanding how our customers are tackling the biggest challenges in healthcare in terms of security, in terms of efficiency and access with our solutions. But one of the great things that we've been able to do here is really get the chance to speak with our customers and understand some of the challenges that they're facing and how they are overcoming those. And so today I'm joined by Matt Eric, again, who's our VP of Sales Engineering, because he and his team are at the front lines with our customers. So before I give Matt some time to introduce himself, I wanted just to start with some of the key trends that we're seeing right now, especially with COVID, right? The impact that COVID has had on many organizations today is that remote, right? Companies, there is actually a report that is from the Technology Services Industry Association that's found that companies say that working from home has had no impact or in some cases has improved productivity for them. And that's across the board. That's not just healthcare. But when you look at healthcare, yes, remote workflows are a thing, right? You have IT teams, you have non-clinical providers that in many cases are now having to work remotely. But then you have clinicians who in some cases are working from remote offices as well, but they're the ones going into the hospitals. And how do they work, when they have their support teams remotely or when their patients are not at the hospital themselves, right? They're remote as well. So Matt, tell us a little bit more about how you're seeing customers tackle the challenges of being remote in healthcare.
Well, thank you, Joel, and thank you for having me. As was mentioned earlier, my name is Matt Eric. I'm the Vice President of Worldwide Pre-Sales at Imprivata. I've been with the company for about 10 years now, and I've had the pleasure of working with our many customers on implementing our solutions and discussing their unique challenges. So I'm sure everybody who's listening is aware of the fundamental changes that have occurred since earlier this year when we got into this pandemic, essentially. And I've talked to many of our customers and how they had to rapidly change their way of working, and many of them now working at home more full-time. And that affects both security in the way they work and also the things that they access and how they access them and how they interact with patients. And it had all changed somewhat dramatically back in earlier this year, since March.
So Matt, tell us a little bit, I guess, about how those workflows are changing now that some of the employees are remote. Tell us a bit more about those workflow changes and perhaps some of the things that you're seeing customers do to ensure security also in those remote workflows.
Sure. So let's start with the workers that may not work from home regularly and now are asked to work from home either more or full-time. So the first thing that IT organizations really had to focus on is getting those workers access to systems that they would normally access in the hospital. So if they didn't already have a viable and scalable remote access solution stood up, they needed to do so quite in a hurry. And remote workers are now accessing things perhaps not through a managed device at home. They may be using an iPad, that's their personal iPad or their personal MacBook, but they still need to get access to those clinical resources, right? And security is an angle of that as well. We've seen many organizations implement single-factor authentication, username and password, as a first means of access. But to strengthen that security, many of them then quickly rolled out two-factor authentication using some sort of push token solution or OTP solution to increase the level of security, but do it in a way that the employee at home can use something they already have, like their phone, for that second factor. So rapid scale up in the need for remote workers to access systems and also access them securely using two-factor authentication.
Yeah, and we see security being a big topic for a lot of folks. And again, I know we're talking about healthcare right now, but it's really just every industry, right? But primarily in healthcare, a lot of cybersecurity, cyber thieves are seeing the vulnerabilities across healthcare, and you look at the studies and research says that there is an uptick in terms of attacks that are occurring, specifically targeting hospitals. And so we see that again, and part of that is, as folks are working remotely, as they're practicing virtual care, there are some challenges there, right? And not just in terms of how they're accessing these systems, but where are they accessing them from? So, Matt, I guess, what are you seeing from customers? How's that challenge playing out for some customers in terms of security and the tools that they're using, the endpoints that they're using to access systems as well?
Yeah, so if you're a cybersecurity-minded individual, right, and you're thinking about the security of your organization, your threat landscape just increased phenomenally as more and more of your workers are now working from home, potentially on less secure networks and using less secure, even personal devices. So all that has now come to bear. So as I mentioned, organizations have quickly adopted and rolled out two-factor authentication for accessing remote resources. They've strengthened their VPN, and they've made more applications available through these remote access technologies. So they're publishing web apps through portals, they're publishing Citrix-delivered applications through portals, and as we'll probably talk about in a few minutes, they're even publishing full virtualized desktops through these portals, so workers from home can get a very similar experience as to what they were used to when they were working within the four walls of the healthcare organization.
Yeah, we'll get to that virtual desktop workflows in a bit, but actually you mentioned VPNs, right? And I know when we've spoken to some organizations, they've actually talked about their desire to move away from VPNs and how they're moving towards in some cases, a cloud-first strategy. And when we think about, again, where we're at right now, the current landscape we're in, cloud first is something that some organizations are exploring. So tell me a little bit about that. What are you seeing? And I don't always see cloud first. Sometimes I see cloud and hybrid apps, and legacy apps being used. So what do those challenges present for organizations when they're having to manage both cloud and legacy apps?
Sure. In healthcare, you do see a lot of non-cloud, or I would call legacy apps, client-server applications. They still exist, and they're very prevalent, particularly like in the EMR space. They're very heavy client-server applications. So in order for users to access those applications from home, typically they have to use some sort of virtualization technology, like Citrix or Microsoft or otherwise. And you mentioned, VPN, right? And one of the challenges with implementing somewhat of a traditional VPN is the need to push out a traditional VPN client for those workers from home to use. And that can be a little bit of a burden for IT to manage. So what we're seeing a lot of customers do is kind of move into the world of a portal where users just access a web page, they log in with now two-factor authentication to give that increased security, and they're accessing both their cloud-delivered applications and their traditional client-server applications that are delivered through that virtualization technology. So it gives them access to everything or close to everything that they had when they were working within the four walls of the hospital, but now they have a much similar experience at home.
Excellent. And so let's pretend for a second I'm a clinician or I'm an IT person, right? I'm at home and I, have lost access to an application or to a system, right? I don't have my password. I forgot my password. So what do I do? What are my options there? Because again, if I was in the four walls of the hospital, I could just put in a call to IT and they'd help me out. What does that look like if I'm at home or if I'm maybe not even at home, but I'm in an office somewhere outside of the hospital?
Sure, and this is one of the challenges that we saw early on when we saw more remote workers at home, right? If they're used to using technologies like single sign-on, where they don't need to remember their username and password all the time, suddenly if they're at home and they don't have access to that single sign-on technology anymore, they might not be able to get into their critical applications, at least easily. So now the IT help desk is flooded with calls asking for password resets to get into applications like EMRs and other things. So what we've seen some of our customers do is actually allow access to the self-service password tools from the VPN portal. So now if a user doesn't have access to single sign-on in that remote experience, but they need to know their credentials, they can go into this self-service portal, which has been published for them, and after they authenticate using their domain credentials, they can essentially look up, like a credential wallet, their encrypted credentials, and they can manually type those in, if they need to those applications. So that greatly cuts down on the calls to the help desk and for the need for resetting users' passwords.
Yeah, and that's something that we're seeing. That's another trend we're seeing, right? When you mentioned cutting calls to help desk, when we see time and time again that IT teams are pressured, left and right, having to not just deal with the same strains that they were dealing with before, but now oftentimes with reduced resources, right? Reduced bandwidth, and so it's certainly something that we're seeing organizations try to tackle. How can they reduce that burden on IT? And that's a good example of that. So thank you, Matt. So you mentioned virtual desktops before, and I promised that I would get back to that. So one of the things that we're we mentioned before in terms of the adoption of cloud, right? Here's a study that found, percentage of healthcare deployments that will be hybrid cloud deployments by 2021 is about a third of it. But then kind of shifting, sorry, I moved the slide a little bit too fast. So diving into that a little bit more, tell me a little bit about how organizations are kind of bringing in both worlds together between virtual desktops and cloud worlds. I hear a lot about perhaps pushing virtual desktops to the cloud. Is that a thing that's happening, Matt?
Yeah, so that thing traditionally, sometimes you might refer to as DaaS, desktop as a service, so cloud delivered virtual desktops. And we've seen that around for years, right? But given the way work has shifted to home, and if organizations were either in the process of implementing VDI or they want to implement VDI, doing it through cloud delivery gives them the option to implement it very quickly and also rapidly scale up as they need it. So for example, we've seen organizations that have delivered or are in the process of delivering VDI to their users in the more traditional sense, where they have VDI stood up in their data center, and for users that are working within the hospital on managed devices, they can get access to those VDI desktops, and as they roam around the hospital, the VDI desktops follow them. But if they now need access to that virtual desktop from home, that has to be provided through the remote access technology, the things that we talked about a little earlier. And if there are more users now working from home that need access to desktops, maybe in longer time periods because they're just sitting at their desk all day instead of walking around the hospital, the demand for the virtual desktop has now gone up. And in order for IT organizations to increase their capacity rapidly, they may not have the resources, the physical infrastructure in place to do that within their own data center. They now need to rely on the cloud as an expansion of their data center footprint to be able to rapidly expand virtual desktops to their ever-growing number of users. And there are companies like VMware and Citrix that are very easily able to do that hybrid cloud virtual desktop environment. And the result is an end user experience that the end user doesn't really know where their desktop is being delivered from, right? It just looks the same to them. And it's a really efficient way to either initially deploy VDI if you haven't done it before, or rapidly expand it if you need to, given the increased remote worker scenario.
And that's a good point, Matt, in terms of efficiency there you mentioned, because one of the things that we see oftentimes is organizations go towards virtual desktops because they are trying to reduce costs. But at times, one of the challenges is they end up actually increasing their costs sometimes, right, in terms of their budgets around virtual desktops. So, we are seeing the trend towards, as you mentioned, pushing some of these virtual desktops onto the cloud. Things like Windows Virtual Desktops, right? WVD is picking up steam, and it's one of those where it's helping reduce those costs for virtual desktops. So it's good to hear that just because an organization is adopting these different types of virtual desktops, virtual delivery models, that the end user workflows aren't really changing, right? That they can still maintain that sense of efficiency and security as they're working, whether it's at home or whether it's at the hospital as well. So that's good to hear that. Is there kind of anything else that you'd like to add around that kind of the balance between efficiency and security for folks that perhaps are adopting virtual desktops as well?
Yeah, there are many good reasons for virtual desktop infrastructure, just in general, probably beyond the scope of this discussion. But very early on, when we were talking to customers about their shift in work and what they were doing just generally to deal with COVID-19 and the general pandemic, is that many organizations who were in areas of the country that were more highly affected by the pandemic, say New York metro area, for example, if they had to bring on many temporary workers to help with the increased patient load, getting them access to virtual desktops in order for them to provide patient care became an issue, right, if that organization relied on virtual desktops. So one way that IT organizations were able to meet that now increased demand was to leverage that cloud-based infrastructure so they could rapidly scale up in some elastic manner and get those additional temporary workers, some of them became permanent, access to the resources that they need to deliver patient care. So very effective use of the technology driven by, I guess, a sudden change in the way healthcare was delivered.
Yeah, and one of the things that we also hear about virtual desktops too, and I'll move on to the next slide in a bit, but one of the last things, that we hear about is, virtual desktops provided a way to really help curb, if there was a ransomware attack, right, organizations could simply wipe some of those virtual sessions and then, restart right where they left off, right, rather than having to spread the malware across the organization. So really virtual desktops help provide a little bit of a buffer in terms of malware within the organization. So again, that's another driver that we are seeing towards virtual desktops. So again, reiterating the fact that it's good that as your organization is changing and evolving, it's good to hear that customers aren't having to deal with also changing kind of how their users are leveraging technology. So one last question I have for you is, and you touched on this a little bit, but in terms of security, what are some ways that customers can enhance their security when they're logging into things remotely to provide virtual care? I think you mentioned a little bit about second factors of authentication, but can you elaborate a little bit on that? Kind of what are some options for end users around that? And does it work with virtual desktops as well?
Sure. So if you think about the traditional way you might access a portal to access your applications, typically it's just with your domain credentials, your username and password. And that's okay, right? But most organizations now want some increased level of security to follow that, and they've implemented two-factor authentication. And for those that aren't familiar with that, the first factor is typically my username and password, and my second factor is typically something that I have, and that's typically a token. And if you remember from a while ago, the tokens that you used to get that were little key fobs with revolving numbers on them, right? Certainly a way to implement two-factor authentication. I type in that revolving number when it asks me for it, now I'm in. But distributing those tokens and the cost of those tokens and the provisioning of those physical tokens can be somewhat challenging, especially when you're trying to deal with everything else that is, related to the pandemic we're facing. So what many organizations are doing is they're implementing a two-factor authentication solution with something that the end user already has in their possession, and that's typically a smartphone. And that smartphone has the capability of either using a text message as that second factor, which is okay, but the better example is to install an application on that smartphone that can be enrolled. And when the two-factor authentication workflow is needed, then the second factor is actually the token that is provided by the application on the phone. So it's a pretty nice end-user experience where the user just uses their username and password as their first factor. They open up their phone, they swipe something, or they hit a button, and that automatically produces that second factor to complete the authentication request. We've seen many organizations implement that two-factor solution and using the phone or phone-based app as the second factor.
Excellent, excellent.
I guess
point there, Matt.
Yeah, the thing, I didn't answer your second question. So to access the virtual desktop piece of it, right? So once I'm in to the portal using my two-factor authentication, I'm usually presented with a number of applications that I can now access, and one of those might be my virtual desktop. And if I click on that icon or series of icons to access my virtual desktop, typically I don't have to re-authenticate again. It just does the authentication for me, and now I'm at that virtual desktop experience, almost as if I'm sitting within the four walls of the hospital.
Yep, excellent. So 2FA, right, second factors of authentication. I know that's a key part of EPCS workflows. EPCS, electronic prescribing for controlled substances. So we know that that's a key part of those workflows. So as clinicians are working remotely, right, some of them are still having to prescribe controlled substances. So tell me a little bit about how these types of clinical workflows are now changing when clinicians are also at times working remotely from an office or at home.
Sure. So for those that might be a little unfamiliar with EPCS, EPCS is, again, electronic prescribing of controlled substances. And the DEA mandates that there are requirements around allowing a provider to prescribe controlled substances and how they go about doing it. And the first piece of that is what we call identity proofing. So Joelle, if you were a provider and I wanted to give you access to prescribing controlled substances, I would first need to verify your identity. You're actually Joelle and not somebody impersonating Joelle. And normally, if we were in person, we could use what's called the institutional identity proofing model. And I would see that you're you would provide me with some form of identification like your driver's license or passport, and I could sign off that you're actually Joelle and complete the identity proofing process. Well, that's a little bit more difficult now that we're all sort of working remote. And again, if you're trying to onboard providers quickly, or maybe providers are changing around hospitals, right, and you want to identity proof them, the DEA has now allowed the idea of remote identity proofing conducted through telehealth type applications like Zoom, WebEx, Teams, and others. So I can complete that identity proofing process using the institutional model using a remote visit. I see that you're on screen, you hold up your your driver's license, your passport, right, and I can sign off on your identity proofing using that remote experience. So that's part one. That has changed. The DEA has made some adjustments to the regulations to support it, and now that allows the provider to at least get identity proofed as the first step of the EPCS process. Now, the second step for EPCS is the ability for that provider to have some credential or set of credentials in order to prescribe a controlled substance. And EPCS suggests that, hey, I have to have something I know, typically my password, something I am, like a biometric, and something I have, like a secure token. In any two of those, I can complete a transaction. Well, if I think about biometrics, like my face or my finger, I typically can't use those from home because I don't have the hardware, or at least the approved hardware, to use any of those modalities. I know my password, so I can use that as a factor. And then something I have could be that token that we just talked about, which is that app on the phone that provides that second factor of authentication when it's needed in the workflow. And not all tokens actually are created equal, or at least meet the EPCS mandate. You have to make sure that your token vendor is DEA approved in order to be able to use it for DEA transactions, EPCS transactions. So again, what we've seen providers do from home for EPCS, they go through the identity proofing process in a remote scenario. they are issued, or their remote token is now allowed for EPCS and enrolled in the system. And in the systems where they need to prescribe, like the EMR, they are now enabled. So they can do their electronic prescribing from home on a device where they can enter their password, and at the time of the transaction, now they use their phone instead of their finger as the second factor. So a little bit different workflow, but they can still achieve the same end result of prescribing the controlled substance and also meet the DEA requirements to do so.
Okay, so we've talked about EPCS, we've talked about remote workflows, we've talked about virtual desktops, but what about if someone's on site and they still have certain remote needs? So in this case, clinician is actually on site, but the IT person that's supporting that clinician is not on site, right? Or the clinician is at the hospital, but they're having to do a telehealth visit, for their patient who's miles away. So let's dive into just 3 of these bullets here, right? So I've listed these out, right? Access to systems to provide virtual care, adjusting security settings to accommodate remote patient care, and the use of mobile devices. So let's start here with the first one here, which is access to systems to provide virtual care. So what changes are you seeing, right? What changes are you seeing in healthcare for clinicians in terms of the applications they're using, or in terms of how they're performing patient care now that they are having to deal with patients who aren't actually in front of them?
Yeah, Joel. So this is sort of the second big trend that I've seen. The first, we've discussed many remote workers at home now. They have to shift in the way they access systems, the way they use systems. And then the second big thing is, all right, now I'm a provider. I'm actually in the hospital, but my patients are remote. Or they're in a portion of the hospital where I might not want to access regularly, like an ICU, and I don't want to go in there and be bedside with the patient if I don't have to, right, and suit up in PPE and everything. So that's the second big shift. So if I'm a provider within the 4 walls of the hospital and I need to engage with a patient that's remote, I've seen everything from a phone visit, where I'm just talking on the phone. I just had one of those with my provider 2 weeks ago. I've seen the use of just standard technologies, like he even asked me, hey, do you want to FaceTime? I'm like, well, I can on the device I'm using, but okay. So that's an option. But more of them are also using, I guess, third-party telehealth or televisit type applications like Zoom and Teams and WebEx. They'll send the patient a link provided through email or text message. That patient gets on and they do a telehealth visit through that application like Zoom. And the experience is obviously not the same as what you would get within the exam room, but you can have a pretty decent experience over a video visit if you can actually consult with the patient, you can see them and you can hear them. So that's one big shift we're seeing, is the use of telehealth technologies for patients that either now can't come into the hospital or may not want to for non-urgent care.
So let's dive into that a little bit more, Matt. And this may seem like a minor example or a minor topic, but I know myself, right? When I go to the hospital, my doctor's in front of me and we're having a conversation, and oftentimes I literally see right behind them that their computer has locked, right? It's logged off. Or sometimes it doesn't. Sometimes it actually, the settings are adjusted so that it doesn't log off while they're speaking to a patient. What things are you seeing in terms of like something like a minor example like that? If they're having to do these virtual sessions with their patients, what if their system locks on them and they're having to retype their passwords, and what impact does that have on patient care? So tell me a little bit about that, how organizations are tackling that potential challenge as well.
Yeah, I'm laughing a little bit because the first time that we heard about this, right, it's one of those situations where you're just going to hit your forehead and go, well, duh, right? So most organizations are very security conscious, and for good reason. And when they're setting up their security parameters around their clinical workstation, right, they want to make sure that if they're unattended for any reason, that they self-secure. They either implement a lock screen, or the screensaver comes up, or maybe they prompt you to re-authenticate or whatever, right? And normally when you're doing an in-person exam room visit, you're interacting with the patient, and maybe the provider swings around on the chair and starts typing on the keyboard and whatnot, and entering the notes in the EMR. Well, that's fine, and that keeps the activity going on the workstation, which would prevent any of these security settings from invoking. The screensaver is not going to come in if you're actually moving the mouse. Well, now if I'm doing more telehealth visits, I'm setting up a visit with maybe you, Joelle, right? And I start talking to you about, whatever ailment you're facing or whatnot. And that could take 15 minutes. That could take 30 minutes or more. And I may not be touching the keyboard or the mouse while I'm talking to you because I want to keep that engagement real. Well, if the security settings aren't changed, about 5 or 10 minutes into that visit, the screensaver could be invoked, or the machine could just lock. Or in the case of Imprivata One Sign, if you have Fade to Lock configured, the screen starts dimming and then you get a countdown timer. And that's there for very good reason for security, but it very much now interferes with that telehealth visit. So, customers started to come to us and say, hey, what can we do? We still want to increase security or keep our security posture, but we want to respect the fact that our clinicians are interacting with our patients differently through telehealth. So how can we, keep the security, but also make sure they don't have to wiggle the mouse every 5 minutes because that's frustrating. So we've been able to work with them, set up appropriate controls in our product and also the Windows environment so that if a telehealth visit is in progress, then the security controls don't get invoked. But if I'm not interacting with you over a telehealth visit, then the normal security timers kick in. So again, it's something that maybe you don't think of a lot, before this all started to unfold. But as we're doing more telehealth visits, it's obviously something that needs to change in the way the workstations and the underlying software are configured in order for that provider to have a good telehealth experience, and the patient for that matter.
Exactly. So switching gears a little bit, but still talking about the on-site and remote workflow. So tell me now a little bit about the different types of devices that clinicians are using now, right? I know here in Imprivata we talk a lot about the users and how they're changing. They've always been changing in healthcare. You have volunteer clinicians, you have locum. It's a constantly changing demographic with students, et cetera. And then you have different locations. Perhaps folks, as we mentioned, are accessing systems remotely. And then there's different types of applications, and we've talked about it today as well in terms of cloud or legacy apps. But what about the actual devices themselves? I know we hear about mobile devices. So tell me about how those workflows look like for clinicians who's at the hospital and is trying to access that, perhaps mobile device, the iPads that they were just donated at the organization. What's their workflow like now that they're having to interact with a mobile device instead of a desktop in some cases?
Yeah, so when this started to unfold, right, we were talking to a lot of customers about how they had to rapidly ramp up their IT infrastructure in order to accommodate what they would consider increased patient traffic. So we saw, organizations building tents in parking lots and putting, temporary exam rooms in parking lots and things like that. And they had to roll out infrastructure to accommodate the clinical workers that would be out there treating patients. And, in not all cases you could run, hard Ethernet wire out there and set up physical workstations. Some organizations basically said, well, why don't we just, put some tablets out there, some Windows-based tablets on a docking station, and then providers could pick them up. If they're using something like Imprivata One Sign, they could tap their badge, they could authenticate to them, and instead of being tethered to a physical clinical workstation, they can now walk around with a very similar experience in their hand, so to speak, and treat patients in that temporary unit. All right, and that's been very effective for a variety of reasons. One is it makes the IT experience mobile. So now the provider can walk around with that laptop, almost like a workstation on wheels, but they have it in their hand, and they can treat patients and interact with folks. They can do telehealth visits if they need to on that device as well, and it provides the same or very similar experiences that they would get from a traditional Windows-based desktop. They get perhaps single sign-on to their applications. They can access their EMR. They can do controlled substance prescribing if they need to. So it's a very nice experience. The other benefit of that we've seen is that it reduces the point of infection. So everyone now is very minded about infection control. So if I don't have to, regularly wipe down keyboards and mouse or monitors for traditional clinical workstations, I might be able to now use tablets, wipe them down when they're, docked, and then provide them to an individual throughout the course of their shift. And if it's just theirs throughout the shift that limits the number of people interacting with it, they can use it through their shift, and when they return it to the dock, they wipe it down again and it's ready for the next provider to use at the start of their shift. So it's really changed the way providers work, and it's also sort of helped with points of infection control, particularly in departments like ICUs that are very concerned about it related to COVID.
Yeah, and you actually mentioned our badge tap capabilities there, and it's interesting because one of the things that obviously we now see personally here, all of us, right, wearing masks and also within hospitals is PPE, right, the gloves, the masks, etc. And so I can only imagine if there's a transition towards mobile devices now with smaller touch screens, trying to log into these with gloves is probably not the ideal workflow, right? So when you mentioned being able to have different ways of logging into these devices, I imagine that that's something that our customers and others across healthcare are exploring, correct? Are you seeing kind of more of that and kind of that demand for different types of ways of logging into these devices, Matt?
Yeah, it's different types of ways to log in. Traditionally they're used to, if they have a technology like Imprivata OneSign, they can tap their badge on the device, and that would be supported with the Microsoft Surface tablet and others. You mentioned PPE, right? And one of the things that we saw early on in the pandemic was providers being very concerned about the supply of PPE. So if they didn't have to mask up and gown up and sanitize and everything to go visit a patient to check on their status, usually for a very limited period of time, ideally we've seen, some customers do that experience using a tablet. So again, the provider has a tablet, they log in, they're walking around, maybe an ICU, they have one set of PPE on because they're not interacting with patients directly, they're interacting with them out in the hallway, and they can use the tablet for even a telehealth experience with a patient that's sitting in the room 10 feet in front of them. And that provides, again, a similar experience to an in-person visit, but it protects both the patient and the provider from in-person contact. So very creative ways about using tablets for both the provider and I'm sure we're going to talk about the patient experience as well.
Yeah, and Matt, you mentioned logging into these virtual, these telehealth apps. You mentioned Zoom, you mentioned Microsoft Teams earlier, and one of the things that I know is important in healthcare in terms of just desktops, right? Logging into desktops is ensuring that you aren't accidentally charting under the wrong patient, right? That you as a user, if you log into a workstation and perhaps it's a shared workstation, that when a second user comes along, right, you've left that workstation, second user comes along, that they aren't accidentally going to be logging into your profile, your accounts. Are you seeing ways that organizations are trying to tackle that with mobile devices, with these emerging different types of endpoints?
As far as telehealth visits are concerned, Joel?
Yeah. As far as being able to switch users, right, from user A to user B, so that when they log into a device and they use a team-capable app, that it's actually them and not someone else logging into that.
Yeah, I mean, that's critically important in both a traditional workstation, right, but also now on these tablets. As I mentioned earlier, if you're switching tablets between users, either between shifts or otherwise, you want to make sure that the tablet is disinfected, but also physically, but also, I guess, disinfected from a point where the previous user's applications and data is turned off or disabled or shut down, so that when the new user picks up that tablet, they're not charting under the wrong ID, they're not logged into the telehealth app using the wrong ID, right? That experience is authorized and personalized for them.
Yep. And I know that some of the organizations we speak with, they deploy the types of technologies where you just dock that device and it's instantly wiped clean, and it's a kind of a new user experience once a new person or a new user picks it up. So I'm sure that that's also something that organizations are exploring. So Matt, I know we are kind of getting towards the second half of our webinar, near the end. I know we've talked about quite a bit about remote workflows and on-site / remote workflows. We've talked about end users being able to balance security and efficiency, but can you tell me a little bit about perhaps the foundation to all this? I know that organizations look at identity governance or risk management, identity management capabilities. Is that kind of what are organizations looking at when they think about identity governance as part of this story as well?
Sure. As you know, when you try and onboard a new user in healthcare, they need access to a variety of systems, typically. And the time it takes to get access to those systems is critically important. If you're just onboarded a highly skilled physician, you don't want him or her waiting for an extended period of time to get access to the systems to be productive. And you also want to get them the right access, right? You don't want to give maybe a nurse access to something a surgeon might have access to, for example. And typically these processes can take a while, right, in systems, and many organizations have found ways to automate them using identity governance and provisioning solutions. And that need has increased, I would say, significantly as you see organizations that have needed to ramp up their staff, maybe with temporary workers, maybe with permanent workers, to meet the demands of the increased patient load due to the pandemic. So it's becoming more important with digital identity and provisioning and governing those identities using some sort of system where you can automate the entire process to make sure people get access quickly, make sure that they get access to the right systems and the right levels within those systems, and the entire chain of that access is available in some sort of report, the governance aspect of it. Also important is when those users leave, again, if they're temporary workers, if they leave the organization, their access should be revoked immediately. And using automated tools like identity governance allows you to automate that access and report on the fact that that access was revoked at the time that individual left the organization. So it is important to an organization. I would say among many things right now, it's becoming more important because of the changing number of individuals that are working at any healthcare organization right now. Right? Organizations are staffing up quickly, they're changing staff, the roles are changing quickly based on patient demand. So having a way to automate that and report on it is becoming ever more critical.
Yeah, absolutely, Matt. And I think while we're seeing all that change, we are seeing the constant remains is security and regulatory demands in healthcare, right? Those are not going away. And so when we look at, the ways that our customers are changing and the way that healthcare is changing, again, the constant remains security and regulations. And so it's interesting to see the way that organizations, and what we've talked about today, essentially, the way organizations are balancing efficiency with security and regulatory demands. So whether they're remote or whether they're on site, it sounds like organizations are really trying to explore how they can continue to balance that. So those are those key questions I had for you. I think we've really covered quite a few topics, but I do want to open it up to the audience now to ask questions. So Molly, I'm going to stop right there and kind of hand it over to you again to perhaps moderate some of the questions we're getting from the audience.
Absolutely. Yeah. Thank you, Joelle, and thank you, Matt, for that fantastic discussion. So attendees, we will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we'll try and get through as many of those questions as we have time for today. But Joelle and Matt, a few have come in while you were speaking. I'm going to start with this one, which came in from a listener. He says, a great deal of news has included Fortune 500 companies ditching leases and dumping their conventional workspace for the long-term future. Do you see the same for healthcare, or is healthcare different?
Yeah, so that's a great question, Molly, and I'll kind of take a stab at that initially and hand it over to you, Matt. So, I think that there's a lot of change, obviously, that's happening everywhere, and every organization is having to adapt to the growing demands. I know here at Imprivata, we have definitely adjusted kind of the way that we approach interactions with our customers to certainly support remote workforce, right? And I myself, right, like much like everyone else is working remotely, and organizations are finding that there's still efficiencies that are gained, right? There's still performance is not being impacted, right? And so organizations are still able to do what they can, just as they were doing before. So I think, when we speak to our customers, I see time and time again that you hear crazy percentages, something like, organizations went from 2% or 10% in telehealth visits to over 300% in telehealth visits. And that's the thing, right? Some organizations are making that shift more so than others. It just really depends on their resources, IT staff that they have on hand, and the demand from their patients, right? If they're, in a certain demographic or population where you're going to have more perhaps vulnerable patients, right? Vulnerable patients to COVID, you're going to see a higher demand for telehealth. And so I think that's what we're probably going to see this for the long haul, right? We're going to see organizations start shifting towards telehealth. And we saw that before. This isn't new. I think what COVID has done is accelerated that push towards telehealth. And so that's one way I could answer. But Matt, I don't know. Tell us, I guess, a little bit more about what we're doing here at Imprivata, maybe to support that virtual interaction with our customers, maybe even professional services or other things like that.
Yeah, I can just comment on the fact that, many organizations have decided to work remote for the short term or maybe even the long term. I've heard of organizations say, we're not going back to the office at all. We're just going to be working remotely from here on out. And I guess in healthcare, I could see, and we've talked to customers who said this, frankly, that, we might have non-patient facing individuals work from home for the foreseeable future. And you can think about that as, perhaps IT organizations or administrators or billing type workers, where maybe they don't need to go into a building anymore, right? If they can work efficiently from home, then why not do it, right? And I think even the way care is delivered is changing. There will be scenarios where you're still going to have an in-person visit. You're going to have to interact with a patient. It just can't be something that's done virtually. But a fair amount of visits, I think, will be conducted remotely going forward, where that in-person interaction isn't completely necessary, right? So I think we're seeing that shift now. So it's very interesting. Our CTO, Wes Wright, was discussing with him yesterday. He's talked to a lot of our customers, and they said, look, we're not going back to the office at least until the middle of next year, right? And we're not bringing vendors in or customers in to talk to us in person for the short term. We're going to do everything virtually. And it's not as 100% as efficient as it was in person, but it's pretty close, right? And I think we continue to adapt to it. So.
Great. Well, thank you both. Matt, related to something you just said, this next question is based on the likelihood of increased virtual visits moving forward. The listener writes, with the increased use of healthcare, with the increased use of virtual technology in healthcare, there has to be a change in the way a patient exam is conducted. Is there a recommended resource for teaching providers to start practicing with this technology? Can either of you point to some recommended resources for this attendee?
So I'll start taking a stab at that, Matt, and then I'll hand it over to you. So in terms of changing the way patient exams are conducted, Matt kind of hinted at this earlier, right? He mentioned it earlier with Zoom and Teams. The way that organizations and the way that clinicians are practicing care is changing, right? We're seeing it right in front of our eyes, right? In terms of clinicians having to be more aware of the information and how they're sharing that information with their patients. I know from personal experience, for instance, my mother has had telehealth visits, and it's a different experience for her, right? Someone that has to be there and has to, show, her knee and what's happening. It's just a different experience. And so I think right now for I think the medical field, and in terms of where they can, learn and gain information, I think places like this, right? Places like a webinar like this, or even speaking with, I know here at Imprivata, we have, we have a clinical team, right, on staff that has been, on the ground and is on the ground, right? They're emergency doctors right now, right? They are emergency doctors. They also spend time here at Imprivata. And so that's again, another place of resources to really learn how, how organizations are able to balance, patient care while also ensuring that they do so in a way that's secure. Because, it changes, right? You may not be able to practice it the same way if your patient is now remote and there's certain information that you have to share differently than you would have before. Maybe the patient has to log into a portal before you can just share information. How do you prove that, the interaction between both people is actually those two people that are supposed to interact with each other? That the patient is who they say they are and that you actually are the care provider that you say you are. So I guess in short, I would say, attending these types of webinars are helpful. I would say speaking to technology vendors in the industry that are well-versed in this is something helpful. We see time and time again folks that are clinicians stepping into the IT realm to understand exactly how they can be more, efficient in this kind of virtual world. So that's how I guess I would say some resources out there. Matt, I don't know if you have any other thoughts.
No, I agree with you. I think, if I interpret the question as, when is a virtual exam appropriate, and, what gets done in a virtual exam versus what's done in an in-person exam, I would, if I'm this individual, I would reach out to my physician leadership in my healthcare organization and just understand what policies that organization is setting in place for what they would allow for a virtual visit versus what is required to be done in person. And these things are kind of shifting right now as we figure this out a bit more. But if you're looking at it from a clinical perspective, I would reach out to my physician leadership and see what the organization that you're working for is doing with regards to virtual telehealth visits.
Thank you, Matt. And thank you, Joelle, for your insights to that question. This next one comes from a listener who is a bit green to health IT, which he or she knows in their question here, but I'm not in IT, so this is a very basic question, forgive me, but what is considered the old or traditional alternative to the cloud? Joelle, do you mind starting off with that one, if you don't mind sharing some insights with this attendee? Yeah,
sure. So, we mentioned it early in the webinar how in healthcare we see folks still quite often using quote-unquote legacy apps, things like the EMR, which tend to be those legacy apps, which are on premises, right? They're ones that the applications are in your data center and that's where it's housed, right? Physically in your data center. What we're seeing now is a shift, and I should actually take that back. It's not that we're seeing it now, we're seeing it more so now, is a shift to the cloud, right? Where instead of these applications actually being hosted in your data center, they're hosted on, Azure, or they're hosted on AWS, right? These other cloud infrastructures that enable an organization not to have to spend all their resources on upkeep of the data center. So we see time and time again organizations are getting out of the quote-unquote data center business, and they're looking to offset some of those costs and put those applications onto the cloud. So that's kind of how I interpret, the old versus the traditional, the old versus the new approach in terms of application delivery. Matt?
No, I think you captured most of it, Joelle, right? So if you think of the way technology or applications were traditionally delivered, they were, if you're a small organization, it might be installed in a server under the desk, right? And if you're a larger organization, as Joelle mentioned, it's in a data center. And if you're not that familiar with IT, it's probably the building you drove by 1,000 times on the way to the hospital, but never really knew what it was because it was all brick and had one window. And that's where all the servers are running that host the applications for that particular organization. The challenge with that is that can become costly to run, especially as you scale it up. You're paying for that building or leasing that building. You're paying for the infrastructure running into it. And you have to be concerned about things like redundancy and scalability and security, right? If I can offload all of that responsibility to somebody else, like an Amazon or a Google or a provider that's offering their solution in a data center that I don't own, some bigger thing down the street, they can be worried about security. They can be worried about scalability. And I just pay them a monthly fee or an annual fee, and I get that security and convenience, and I don't have to worry about it myself. So again, we're seeing many organizations adopting cloud technology because it allows them to rapidly scale up, rapidly provision, and not have to worry about the things that they would typically have to worry about in a data center, which are things like scalability, security, redundancy, and so forth. So that's the way technology is shifting. And I guess from an end user perspective, you may never know the difference that your application is being delivered from the cloud or the data center down the street. It's just the way that IT has decided to architect that solution. One other final thought there is that cloud being in a much bigger data center down the street, I guess, allows end users to access that technology from almost anywhere, right? So I no longer perhaps have to log into a VPN or get access to that internal data center system anymore. If it's in the cloud, that allows me to access it almost anywhere I am. And that becomes ever increasingly important as we see providers and even patients move about the healthcare ecosystem.
Okay, thank you both. This attendee is curious about any thoughts you might have about Bluetooth's potential to make things more touchless. Can Bluetooth also be used to make things more touchless? I know doctors in ICUs especially are wanting more touchless communications since they're wearing PPE. This may be a different topic, but curious to get your thoughts on whether Bluetooth presents a secure technology option for touchless communication.
Yeah, so I'll start there. Yeah, I'll start there again and hand it over to you, Matt. So, I know that from our perspective, we actually have, have had customers that have leveraged technology, even from us, from Imprivata, around the leverages Bluetooth technology to help unlock and lock devices and systems or desktops. So, examples we've seen is, if a provider is working on their desktop and they walk away, but they have their mobile device on them, there's Imprivata, can detect the presence of that mobile device via Bluetooth technology, so that when that physician walks away, the workstation will lock automatically, and then when they return to that workstation, the workstation will then unlock automatically again. So again, that's leveraging Bluetooth technology. It's kind of leveraging what we call continuous authentication, right? Because it's constantly checking for the presence of that mobile device. So yes, I guess to answer the question, yeah, we are seeing touchless capabilities, particularly driven by Bluetooth technology.
Yeah, I would agree with that, Joel. I mean, especially in the case of some sort of authentication or verification workflow. We've seen in the past Bluetooth or other types of technologies being used for what we would call primary authentication, where the idea is that some user would walk up with a Bluetooth-enabled device and automatically authenticate to a workstation or an iPad or something like that. That works okay in a scenario where it's a one-to-one relationship between you and that device. But in healthcare, we typically didn't see, particularly in a busy clinical setting, if there are many users trying to use a device or around a device, that form of authentication by just presenting that Bluetooth device didn't really work well, because the device doesn't know who's trying to authenticate if there are many individuals in front of it. So we've implemented a technology where you authenticate once using some intent, like your password, and then the Bluetooth is your second factor. And as Joel mentioned, if you walk away, secures the workstation, and if you happen to walk back up, it will re-enable that workstation or re-log you in if no one else has attempted to use that workstation. And it's done in a way where if you're familiar with Bluetooth, you don't have to pair that device. You don't have to go through a pairing process. It's only done once, and you can use that device with any workstation that's enabled with Bluetooth.
Okay, and our last question for the time we have is, oh, you know what? That's actually it. So yes, Joel and Matt, that's it for our questions. Thank you so much for sharing your responses, and attendees for submitting your questions. I thought we had one more there, but we actually made our way through them. So that is all the time we have for today. I want to thank Matt and Joelle for their excellent presentation and to Imprivata for sponsoring this webinar today. Attendees, we hope you enjoy the rest of your day, and we look forward to having you join us for future webinars. Thank you very much.